Welcome. Today is the day 2 of our workshop. Today we will be discussing behavior therapy, cognitive therapy, and client-centered therapy. Behavior therapy is that all the basic assumption of this therapy is that all of the human behavior is learned through classical conditioning or operant conditioning. And human mind is like tabula rasa. It is in a blank state, and all of its behavior is because of the conditioning, classical or operant conditioning. Uh, the abnormal behavior of the clients or patients is due to the conditioning, and it can be unlearned, and new behaviors can be taught through conditioning. Uh, Now, the techniques we used in behavior therapy today we will be discussing are systematic desensitization, flooding, implosive technique, which is also called aversion therapy, and modeling. Modeling is from the Bentura's social learning theory. Principles of behavior therapy. What are the principles of behavior therapy? One principle is classical conditioning. Uh, Learning is because of the association in which neutral stimulus elicits a response which previously did not give a response. This explains phobias. Uh, uh, let's say a neutral stimulus was presented like the sound of a bell in the experiment with the dog that Pavlov did. Uh, the neutral stimulus was the bell. After some time, the dog learned to associate the bell with the food, and we started salivating on the sound of the bell. This is classical conditioning, and this explains phobias, how a person develop a fear of something, because he starts being afraid of that because of the classical conditioning. Somehow he is conditioned to be afraid of that particular object, or let's say a dog, and a dog barking, and this is because of the classical conditioning. Now we come to the operant conditioning. In the operant conditioning, all of the learning is because of the rewards and the punishment. Uh, if a person is rewarded for a behavior, he will likely continue that behavior in the future. And if it is punished for the behavior, then it will extinguish that behavior. This explains eating disorders. And when a person is eating, uh, and he cannot stop eating, it's because he is getting a reward for eating. He's getting let's say a person who has suffered from trauma will continue to eat. This will then help him reduce his trauma, psychological trauma, and this will then result in eating disorder. uh, Behavior therapy deals with the client's current problem and not the past, like whatever the behavior. It's like treats a human being like a machine. Whatever is the behavior a client is performing, a human being is performing, we just deal with that, and it is not because of the past. We don't assume that it is because of something that happened in the past in behavior therapy. Now, one of the techniques is systematic desensitization. This is usually done with phobias, and it was developed by Joseph Wolpe for the treatment of phobias, especially. In it, a patient is first asked to relax on a couch. Patient relaxes on a couch. Um, this will then cause him to relax. In a relaxed state, we make a hierarchy of anxiety provoking situations from least fearful to the most fearful situation. When the patient is relaxed and we present that least fearful stimulus or a situation, we ask him to to imagine a situation in which he is fearful. Then his relaxation will act as a counter to the anxiety that is produced by the phobia. Uh, Yeah, it will help him it will help him reduce the anxiety that is produced by the phobia. And this is used in phobias as certain sexual disorders, anxiety disorder, and OCD. Now, Storm's implosive technique, I like to call it implosive technique because that's my favorite word. I don't like to call it flooding. It was developed by Stomp, and there is no grading or hierarchy in this technique. The most fearful, anxiety provoking stimulus is presented directly to the client. Uh, and the client it is assumed that the client attempt to escape the stimulus reinforces through conditioning. Uh, when a client tries to escape from the situation, let's say if a client is afraid of the lizard, and we put him in a room with a lizard, when the client tries to escape from the room, then he will then his this escape from that situation will reinforce his fear through conditioning. It will condition him that if he escapes from that situation, he will not be fearful anymore. He will not be anxious anymore in that situation. So this then reinforces the phobia. It is not so what we do in this situation, we just present the most fearful object to the client. Let's say if he's afraid of the lizard, we just put him in a room with a lizard, and eventually he will reduce his fear of the lizard. But it is important to know that it is not suitable for people with heart diseases or hypertension, because it can then immediately it will increase their blood pressure, which can lead to heart attack or a stroke. And people who are in fragile and psychological state, like if a person is in a fragile state, we should not use this technique with them. We should use these techniques with healthy individuals mostly. Aversion therapy. In this therapy, uh, a noxious stimulus, which is also punishment technique, is introduced after a behavior, then the response is inhibited. So what we do is we whenever the behavior that we are trying to change occurs, we present a noxious stimulus with it, and that noxious stimulus then acts to reduce or extinguish the undesirable behavior. For example, if a person we want to reduce a person's alcohol consumption, we will put a medication in that alcohol which will cause him to vomit, and it will make him noxious. This will then reduce his uh, uh, his alcohol consumption because of the conditioning. We are trying to make him unlearn this behavior through conditioning. So he will associate the alcohol with the vomiting, and this will then cause him to extinguish that behavior of excessive alcohol consumption. So the type of noxious stimulus that we can use is an electric shock, vomiting inducing substance that I just discussed, social disapproval, uh, and corporal punishment. It is suitable for OCD, alcoholism, and paraphilias. Now, modeling. In modeling, desired behavior is performed in front of the client. Usually, the model are parents and teachers, and sometimes it can also be the therapist performing a desirable behavior in front of the client. It is mostly suitable for children who are phobic. Uh, for example, if a child is fearful of uh, a rabbit. So what we'll do is we will try to go in front of the rabbit, in front of the child. We will, as a therapist, go in front of the rabbit, touch it, hug it, love it, and this will cause the child to learn that behavior, and then the child will perform that behavior, and his phobia of a rabbit will be reduced or is extinguished. Now we come to the cognitive therapy. The basic assumption is that we are working on the thoughts of the person in this therapy, right? It is the negative view of the world, of himself and the future that are causing the disorders. We try to identify those negative thoughts and try to alter those thoughts. It is a short-term therapy, and it is also symptom-based therapy. We try to reduce the symptoms. Uh, Maladaptive thinking in this therapy is altered. Uh, it uses a collaboration between therapist and a client. Therapist and a client collaborate, and they have active participation in the therapy. Unlike psychoanalysis, in which a therapist just sits without speaking behind a client. Uh, in it, they both collaborate. Therapist and the client collaborate. They speak openly about the problem and whatever they were discussing in the therapy session. Uh, Negative cognitions about the world, future, and self are changed in this therapy. Mm. And the problematic behavior um, is also changed in order to change the cognitions. And sometimes, just like thoughts are affecting the behavior, sometimes behavior is also affecting the thoughts and the cognition. So we try to change the problematic behavior in order to change the cognitions. Now the assumption: the person perceives the event in terms of the cognition rather than the event itself. If a person is, for example, um, is in a stressful situation, uh, he has let's say he lost a job, or he was traveling to a job, and there was suddenly um, someone used their horn of their car, and this was a disturbance to the client. So with the way the client will perceive the situation is through his cognitions rather than the event itself. So the stress that will be experienced by the client will also be because of the what he is perceiving rather than his the event itself. Uh, so it is based on the client's thoughts and behavior. Um, the aims to change the cognition of the client, that will change the behavior. If we change the cognition of the client, it will change the client's behavior. If we want to change their behavior, we will try to change their cognitions, their thoughts. We will try to change those to change their behavior. Change can be begin by two methods: cognitions and behavior. uh, Cognition, we change the cognition, we can change the feeling and the behavior. And if we try to change the behavior, uh, then we can change the feelings and the thoughts as well. This is especially useful in schizophrenia and delusion, the changing of the behavior. Now, how some of the techniques that we can use in the cognitive therapy are distractions to interrupt the cognition. The client is forcefully attend to something other than the intrusive thoughts. For example, in this we can use the rubber band technique. Whenever the intrusive thoughts or unpleasant thoughts come to client's mind, he can use the rubber band, which is attached to his wrist. He will pull it, and that rubber band will cause pain to his arm. This will cause him to distract from the stimulus. Uh, so this is what we can use to interrupt the cognitions. Now, when and some emotions are producing a cognitions, we can try to give the client an alternate statement to balance his intrusive thoughts. For example, if a person thinks that he's not good enough, um, or he might think that let's say if the client thinks that he's not good enough, we will give him alternate statement like, no, I am good. I can perform this task. I can be just as good as anyone else. We can go give them an alternate statement, which will then balance the intrusive thoughts. Now, what we can use techniques to alter the cognitions of the client. According to the Aaron Beckett involves, first we will try to identify the maladaptive cognitions. What cognitions are maladaptive? We try to identify them. Uh, and we then try to identify the logical errors that are causing those cognitions. Uh, and then we try to challenge the underlying assumptions that generate the cognition in the first place. We will use the questioning method. We will question the client whether they are true or not, and this will challenge their underlying assumptions that generate the maladaptive cognitions. Problem solving techniques. In this, we will try to define the problem first of all. What is the problem? And then we define it. Divide it into manageable problems. We divide one problem into manageable problems, and then we think of each of those manageable problem an alternate solution. And from this alternate solution, we ask the client to select the best solution, and then we ask the client to carry out that solution, and after that we check the results. If the results are not good when they try, when we go back and try a different solution. Now, this is useful in many disorders: OCD, PTSD, suicidal ideation, panic, schizophrenia, eating disorders, depression, and marital problems. Now we come to client-centered therapy. The objective of this therapy is to resolve the incongruence of the client and help them to accept themselves. Um, and Then the therapist in this therapy takes a non-directive role. He does not direct the client to speak about certain topic or to speak about a problem. The therapist takes a non-directive approach in this, unlike cognitive behavior therapy. Now, main components of there are three main components of client-centered therapy. Congruence, which is the willingness to be open and genuine to the client and not to hide behind a professional facade. Empathy, showing emotional understanding of the client in terms of feeling what it would be like if the therapist was in the client's place. This is showing of the empathy. This is very important in a therapy session. And giving unconditional positive regard to the client. This means that therapist accepts whatever the client is saying, whatever the client's opinions are, whatever the client's actions are, whatever the client's attitudes are, without disapproving them or judging them. We don't judge them. This is an unconditional positive regard that we should give to the clients in client-centered therapy. Now, the techniques of client-centered therapies are listening, accepting, respecting the client, and understanding the client and responding to the client. Now, this is a very simple therapy, client-centered therapy. We normally allow the client to do whatever the client wants to do in the therapy session. If the client wants to sit and does not discuss anything, then we allow the client to sit and does not discuss anything. If a client wants to discuss about his parents, we can allow him to talk about his parents. If a clients want to discuss something at school or work, then we allow the client to discuss his school or work. We don't stop them. We don't direct them to talk about something else. We let the client do whatever he wants to do and whatever he wants to discuss in the therapy session. Uh, this is very simple therapy. This came from the Carl Rogers researches, and even though it is very simple, it is highly effective therapy. When a client is given love and understanding, then he can bring major changes to his life. This is the basic assumption in the client-centered therapy. This is used in schizophrenia, personality disorders, cognitive dysfunction, depression, anxiety, alcohol addiction. That's it for our workshop for day today. Thanks for watching, and if you have any questions, leave a comment.